For decades, we've been told the same thing. At your age, you need to get every possible test done. But modern science reveals an uncomfortable truth that few doctors dare to say out loud. After 70, some medical tests that seem indispensable can actually cause more harm than good. This isn't about abandoning your health care, it's about protecting it with intelligence. I'm Dr. Susan Parker, wellness and longevity advocate, and today I'm going to reveal 5 medical tests you should seriously question after 70, with scientific evidence backing every word. What you're about to hear may surprise you, even make you uncomfortable. But if you've reached this stage of your life, you deserve to make informed decisions about your body, not simply follow protocols designed for younger people. Let's get straight to it. The medical industry operates under a seemingly logical principle. Early detection saves lives. And in many cases, this is absolutely true. But there's a breaking point that's rarely discussed openly. When you reach 70, your body, your life expectancy, and your priorities change dramatically. Tests that benefit a 50-year-old can trigger a cascade of invasive procedures, unnecessary anxiety, and treatments that deteriorate your quality of life without significantly extending it. The problem isn't detection itself. The problem is what comes after. Biopsies, surgeries, chemotherapies, radiation, medications with severe side effects, all to treat conditions that might never have affected your life. This has a name in medicine: overdiagnosis. And after 70, overdiagnosis becomes more common than useful diagnosis. Imagine discovering a small, slow-growing cancer that, according to statistics, would take 20 years to cause any problem. If you're 40, treating it makes sense. But if you're 75, that same cancer will probably never affect you. However, the treatment can rob you of months of well-being, energy, and autonomy. That's the dilemma nobody clearly explains. Now, let's talk about the first test you should question: routine colonoscopies. For years, this exam has been the gold standard for preventing colon cancer. And it's true that it saves lives, especially between ages 50 and 65. But after 75, the equation changes drastically. The most updated medical guidelines, including those from the U.S. Preventive Services Task Force, recommend that people over 75 who have had previous colonoscopies with normal results should stop getting this exam. Why? Because the risks begin to outweigh the benefits. A colonoscopy isn't a minor procedure. It requires sedation, intense bowel preparation that can cause dehydration and electrolyte imbalances, and carries risks like intestinal perforation or bleeding. At 75, your digestive system is more fragile, your heart may not tolerate sedation well, and recovery is slower and more complicated. Additionally, colon cancer detected after 75 tends to be extremely slow-growing. Many of these tumors would never cause symptoms in your remaining years. But once detected, an entire treatment protocol activates that can include major abdominal surgery, with weeks or months of difficult recovery. Think about this. If you've maintained regular screenings during your adult life and never had polyps or suspicious lesions, the probability of developing aggressive colon cancer after 75 is minimal. In that context, subjecting yourself to a colonoscopy every 5 or 10 years is exposing yourself to concrete risks for increasingly doubtful benefit. The key here isn't ignoring symptoms. If you notice blood in your stool, persistent changes in your bowel habits, unexplained abdominal pain, or weight loss without reason, that certainly warrants investigation. But routine colonoscopies, scheduled simply by age and without symptoms, are a different story. Let's move to the second questionable test: annual mammograms after 75. Here, the debate is even more delicate because breast cancer remains a legitimate concern at any age. But science shows us important nuances that change the risk-benefit equation. Mammograms detect small tumors, even microscopic ones. This seems ideal, but many of those tumors would never grow enough to threaten your life. They stay there, inactive, coexisting with you without causing problems. However, once detected on a mammogram, medical protocol demands action: biopsy, surgery, radiotherapy, possibly chemotherapy or hormone therapy. After 75, especially if you have other health conditions like diabetes, hypertension, or heart problems, these treatments can be devastating. Breast surgery, though it seems simple, involves general anesthesia, risk of infection, prolonged pain, and mobility limitation in the affected arm. Radiotherapy causes extreme fatigue, skin burns, and can affect your heart if the tumor is on the left side. Research shows that in women over 75 without symptoms, annual mammograms don't significantly reduce mortality. This means getting or not getting the test doesn't substantially change how long you'll live. What does change is the possibility of spending your final years dealing with aggressive treatments for tumors that never would have killed you. Now, this doesn't mean completely abandoning surveillance. If you feel a new lump, notice changes in the shape or texture of your breast, observe nipple discharge, or any visible alteration that requires immediate evaluation. But subjecting yourself to routine mammograms every year without any symptoms or personal history of breast cancer is a decision that deserves an honest conversation with your doctor about your priorities and quality of life. The third test you should question is the prostate-specific antigen exam, known as PSA, in men over 70. This is one of the clearest examples of overdiagnosis in modern medicine. PSA measures a protein in the blood that can elevate when there's prostate cancer, but it also elevates due to infections, benign prostate inflammation, after bicycle riding, after intimate relations, or simply from natural aging. This generates an enormous amount of false positives. When PSA comes back elevated, the next step is usually a prostate biopsy. This procedure involves inserting a needle through the rectum to take multiple tissue samples from the prostate. It's painful, can cause bleeding, severe urinary infection, sepsis, and in some cases, permanent damage to urinary function or intimate health. Here's the shocking part. Most prostate cancers detected in men over 70 are so slow-growing they would never cause any symptoms. Autopsy studies show that up to 80% of men over 80 have microscopic prostate cancer, but the vast majority died from other causes without even knowing they had it. Prostate cancer treatment, on the other hand, has severe and permanent consequences. Surgery to remove the prostate can cause total urinary incontinence, requiring the use of diapers for the rest of your life. It can also completely eliminate the ability to have a fulfilling intimate life, affecting not only physical function, but confidence and emotional connection with your partner. Radiotherapy, though less invasive than surgery, can cause chronic rectal inflammation, persistent diarrhea, rectal bleeding, and also severe problems in intimate health. And all this, I repeat, to treat tumors that in most cases would never have affected your life. The most respected medical organizations worldwide, including the American Urological Association, have revised their recommendations. They no longer suggest routine PSA screening in men over 70, unless they have a life expectancy greater than 10 or 15 years, and fully understand the risks of overdiagnosis. If you're 75, enjoy excellent health, and your parents lived into their 90s, perhaps PSA is worth considering. But if you have chronic conditions, limited mobility, or simply want to enjoy your golden years without medical anxiety, questioning this test is absolutely reasonable. The fourth questionable test is preventive cardiac scans, specifically coronary calcium tomography and CT angiography, in people over 70 without cardiac symptoms. These studies promise to detect blockages in heart arteries early, but in practice, they can trigger a cascade of unnecessary interventions. After 70, it's completely normal to have some degree of calcification in coronary arteries. It's part of aging. Finding calcium in your arteries doesn't mean you're about to have a heart attack. In fact, many people with significant calcification live years without any cardiac event. The problem arises when these studies show ambiguous findings, an artery with 50% obstruction, for example. That result generates fear, both in you and your doctor. And fear leads to action. More studies, cardiac catheterizations, stent placement, or even bypass surgery. Cardiac catheterizations involve inserting a thin tube through an artery in your groin or wrist until it reaches your heart. It can cause bleeding, arterial damage, heart attack during the procedure, or kidney problems from the contrast dye used. And stents, those small metal tubes that keep arteries open, require lifelong anticoagulant medications with risk of serious bleeding. Multiple studies have demonstrated that in older people without symptoms, placing preventive stents doesn't reduce heart attack risk or increase life expectancy compared to simply taking medications and maintaining healthy habits. Bypass surgery is even riskier, with weeks of recovery, risk of infection, subsequent cognitive problems, and chronic chest pain. If you have chest pain with exertion, unexplained shortness of breath, severe palpitations, or any symptom suggesting an active heart problem, those studies are completely justified. But getting preventive cardiac scans without any symptoms, just because you turned 70, can open the door to treatments that will do more harm than good. Finally, the fifth test you should question is repetitive bone density scans in adults over 80, especially if you're already taking osteoporosis medications. Bone densitometry measures how dense and strong your bones are, helping predict fracture risk. This exam is extremely useful in early postmenopausal women and in men over 65 with risk factors. It helps you decide if you need preventive treatment. But once you reach 80, especially if you've already been diagnosed with osteoporosis and are on treatment, repeating densitometry every 1 or 2 years makes little practical sense. Osteoporosis medications, like bisphosphonates, work very slowly. Your bones don't strengthen dramatically from 1 year to the next. And small changes in bone density measured by the study don't significantly change your actual fracture risk or modify your treatment. Additionally, the truly important metric at 80 isn't how much density your bones have, but how stable you are when walking, how strong your balance is, and how quickly you can react to avoid falls. An 80-year-old with severe osteoporosis but excellent balance has less fracture risk than someone with relatively dense bones but balance problems and frequent dizziness. Medical resources are limited, including your time, your emotional energy, and your money. Every medical appointment, every study, every result you wait for generates anxiety. Repeating unnecessary densitometry consumes those resources without offering useful information that changes your management. What really protects your bones at 80 isn't knowing the exact density number, but maintaining muscle strength with gentle resistance exercises, walking daily to stimulate bone formation, ensuring sufficient vitamin D and calcium in your diet, and doing balance exercises like Tai Chi or adapted yoga. Those concrete actions reduce fractures much more than an annual densitometry. Now, I want you to understand something crucial. Questioning these tests doesn't mean rejecting modern medicine or abandoning your health care. It means being intelligent, selective, and focused on what truly matters: your quality of life, your autonomy, and your daily well-being. Medicine was originally designed to cure diseases and relieve suffering. But in recent decades, there's been a subtle shift toward detecting risks in healthy people. This approach has value in certain contexts, but it can also convert vibrant, functional people into anxious patients, subjected to endless cycles of tests and treatments. After 70, your priorities should change. It's no longer about adding years to your life at any cost, but adding life to your years. It's about maintaining your independence, enjoying your family, continuing activities you love, and feeling good in your own body. Every medical test you accept must pass a simple test. Can this study lead me to a treatment that will improve my quality of life without causing unnecessary suffering? If the answer is uncertain or probably not, then you have every right to question that test. Let me share the story of Margaret, a 79-year-old woman who came to my consultation recently. Her doctor had requested a complete battery of studies: colonoscopy, mammogram, bone density scan, and cardiac scan. Margaret had no symptoms of anything. She felt well, walked every day, played with her grandchildren, and enjoyed her garden. When we reviewed each test together, I explained the real risks and benefits. Margaret made a conscious decision: decline the colonoscopy and mammogram, accept only a basic electrocardiogram, and maintain her bone density scan because she had recently started osteoporosis treatment. It wasn't rebellion or denial, it was wisdom. 6 months later, Margaret remains equally active, without anxiety about pending results, without invasive procedures in her history, and above all, without regrets. She understands that if any concerning symptom appears, medicine will be there to help. But while she feels good, she doesn't need to search for problems where there aren't any. Here's what few doctors admit openly. Many of these tests continue being ordered by inertia, outdated protocols, or fear of lawsuits. A doctor who doesn't order a colonoscopy for a 75-year-old patient may feel they're risking their license if, by extraordinary coincidence, that patient develops colon cancer. But medical guidelines are changing precisely because the evidence is clear. Organizations like the American College of Physicians, the American Geriatric Society, and the U.S. Preventive Services Task Force publish increasingly conservative recommendations for older adults. The problem is, these changes take years to reach daily practice. So what can you do? First, inform yourself. Don't accept any medical test just because your doctor ordered it or because you've always gotten it. Ask specifically, what is this study for? What will we do differently if the result comes back abnormal? What are the risks of the study itself and the treatments it could trigger? What happens if I decide not to get it? A good doctor won't be offended by these questions. On the contrary, they'll value them because they demonstrate you're an active, conscious, and responsible patient of your health. If your doctor gets upset or pressures you without clearly explaining, perhaps it's time to seek a second opinion. Second, know your values and priorities. What's most important to you at this stage of your life? Maintaining your independence, avoiding hospitalizations, being able to travel and enjoy family, minimizing medications and procedures? Once you're clear about this, medical decisions become easier. Third, communicate your decisions clearly. If you decide to decline a test after consciously evaluating it, say so firmly but respectfully. Explain that you understand the risks and benefits, that you value medical advice, but that you've decided to prioritize your quality of life. Ask that it be recorded in your medical record that it was your informed decision. Fourth, maintain a close relationship with your body. Know your normal symptoms. Notice changes. If something new appears, whether pain, bleeding, lumps, changes in appetite, unexplained weight loss, or any alteration that persists more than 2 weeks, seek medical attention. Early detection of real symptoms remains invaluable. Fifth, focus on what does work at any age. Daily movement adapted to your capacity, balanced nutrition with sufficient protein to maintain muscle, adequate hydration, restorative sleep, genuine social connection, and life purpose. These pillars protect your health much more than any battery of preventive exams. True prevention after 70 isn't in medical offices or diagnostic machines. It's in how you live each day. It's getting up with energy, walking without fear of falling, enjoying your meals without absurd restrictions, keeping your mind active with reading or stimulating conversations, and cultivating relationships that fill your heart. Let me be completely clear. I'm not suggesting you ignore your health or reject all modern medicine. Medical advances have achieved that we reach 70, 80, or 90 years with unthinkable quality of life just 50 years ago. Antibiotics, surgeries when necessary, well-used medications, and targeted treatments save lives every day. What I'm questioning is excess, defensive medicine, routine tests done by protocol without considering each person's individuality, aggressive treatments for conditions that would never cause problems. The medicalization of normal aging. Aging isn't a disease. Being 70, 80, or 90 doesn't automatically convert you into a patient who needs to be constantly monitored, scanned, and treated. You're a person with history, wisdom, and the right to live your final years with dignity and autonomy. Every test you consciously decline is an act of self-love. It's saying, I trust my body, I trust my ability to notice when something's wrong, and I choose not to live in fear of diseases that may never affect me. It's recovering control over your medical life instead of blindly handing it to the system. And here's something beautiful. When you stop chasing every possible health problem, when you stop living based on the next medical appointment or lab result, an enormous mental and emotional space opens up. A space you can fill with things that truly matter. Imagine waking up without anxiety about a pending study. Imagine planning a trip without worrying about coordinating medical appointments. Imagine enjoying a meal with your family without thinking about slightly elevated cholesterol values. That freedom is possible, and it's your right to claim it. Of course, there will be doctors who disagree with this approach. There will be well-intentioned family members who tell you you're being irresponsible. But nobody else lives in your body. Nobody else will experience the consequences of every medical decision you make. Only you. So, I invite you to do something radical. Trust yourself. Trust your capacity to make informed decisions about your health. Trust that if you've cared for your body for decades, you can continue doing so without excessive medical surveillance. And when the moment comes, when you really need medicine, when a genuine symptom appears or a condition requiring intervention, you'll be in a much better position to receive it. Because you won't be exhausted by years of unnecessary procedures. Because you'll maintain your confidence in the medical system for when you truly need it. In summary, after 70, question routine colonoscopies if you've had several with normal results. Question annual mammograms if you have no symptoms or personal cancer history. Question routine PSA understanding overdiagnosis risks. Question preventive cardiac scans without symptoms. And question repetitive bone density scans if you're already on treatment and your bones are stable. Each of these decisions must be yours, made with complete information, considering your particular situation, your values, and your priorities. There's no universally correct answer. There's only the correct answer for you. The most important thing I want you to take away today is this. You deserve to live your golden years with fullness, not with fear. You deserve to enjoy each day without the constant shadow of possible future diseases. And you deserve to make decisions about your body based on wisdom, not rigid protocols designed for younger populations. Longevity with quality isn't about how many tests you get, but how much life you put into each moment. It's about getting up each morning with purpose, maintaining your independence as long as possible, cultivating meaningful relationships, and doing things you love while you can. If this message resonated with you, share it with someone who's navigating these complex medical decisions. We all deserve to age with dignity, autonomy, and the freedom to choose which medical battles are worth fighting. It's never too late to recover control of your health and live on your own terms. Take care of yourself, trust yourself, and remember, the best medicine is a life lived fully, with consciousness, purpose, and joy. See you in the next video.